Live from the Hive, I'm Dr. B, and this is The Buzz on acetaminophen and ibuprofen for kids. Okay, first up, a disclaimer because we're going to be talking about medication dosages. This information is for educational purposes only, and it's for those patients that I have talked to and given them instructions in my office so that they can refer to this at a later time. Okay, here we go. So first, let's talk about acetaminophen. This is also the active ingredient in Tylenol. Publix makes a brand, and CVS makes a brand, and Rite Aid makes a brand of acetaminophen, but it's all the same stuff. All forms of Tylenol are the same strength. Children's and infants, children's acetaminophen, infants acetaminophen, it's all the same strength. So you can use infants or children's, doesn't matter. It's going to be the same strength, it's going to be the same dose. Tylenol or acetaminophen is good for fever and pain. It's not really good for inflammation. You should not use it less than 2 or 3 months of age. In that case, if you have a fever, really should get checked out by the doctor or go to the ER. It can be something very serious in the first 2 to 3 months of age. So that needs to be checked out. But above that, you can use Tylenol. Now, acetaminophen comes in a couple different forms. It comes as a liquid, which is 160 milligrams per 5 mLs. 5 mLs is the same thing as 1 teaspoon. The liquid, if it's children's acetaminophen or infants acetaminophen, again, it's exactly the same concentration, 160 milligrams in every 5 milliliters or 1 teaspoon. There's also chewable form, which is 80 to 100 or 120 milligrams, and a suppository form. A good brand name is Feverol, but they do make just regular old acetaminophen suppositories, and these come as 80 and 120 milligrams. Those are very easy to find. 325 milligrams, there's actually one I think even bigger than that, but 80 and 120 milligrams is really the easiest ones that you're going to be able to find. As far as dosing of acetaminophen, the dosage that you see on the box is probably going to be a little less than the maximum that the child's able to have safely. And the reason for that is if you're the people who make Tylenol or acetaminophen, you're going to send this medicine out into the world, you want to be very careful with how much you tell people to take. Now, in my office, we talk about the maximum dose, and the dosage goes like this. If you want to be very precise about giving acetaminophen, you want to give the maximum safe amount, then the dose is going to be 160 milligrams or 5 milliliters or 1 teaspoon, that's all the same thing, for every 24 pounds that the child weighs. If you're using the liquid, like we said, 160 milligrams being 1 teaspoon, then if the child weighs 12 pounds, you would use half of that, which is 80 milligrams. You're following along on the chart here, which is 2.5 milliliters or 1/2 teaspoon. Again, 24 pounds, you got 160 milligrams, which is 5 milliliters or 1 teaspoon. 36 pounds, that would be 240 milligrams or 7.5 milliliters, which is 1.5 teaspoons. And finally, if we want to do the 48 pounds, that's going to be 160 milligrams twice, which is 320 milligrams, which is 10 mLs, and it's 2 teaspoons. And you can look at this and you can kind of figure out, well, if my kid's in between 12 and 24 pounds, I want to use in between 1/2 and 1 teaspoon. So maybe I'll give them like 3/4 of a teaspoon, which would be 3.75 milliliters. And if you use that chart, you should be able to figure out what the maximum dose there is. Acetaminophen or Tylenol can be given safely every 4 hours. Now, the next medicine we want to talk about is ibuprofen, also known in the brand names as Motrin or Advil. This is a non-steroidal anti-inflammatory drug, which means that it works not only for fever and pain, but it's also good for inflammation and swelling. We like using it when someone has joint pain or they've got a sore throat and they have some swelling of their tonsils, that sort of thing. It seems to work better than Tylenol, but it can have a few more side effects, and we'll talk about those in a few minutes. Like I said, Tylenol you can use after the child's about 2 to 3 months of age. Motrin, Advil, or ibuprofen, this one you have to wait until they're at least 6 months of age. That's going to be the safest thing. Now, as far as dosage forms for ibuprofen, this is where things get a little bit confusing. Remember, all forms of acetaminophen or Tylenol have the same concentration, but ibuprofen is different. As you can see on this chart, The infant's liquid of infant's ibuprofen or infant's Motrin or infant's Advil is going to be 100 milligrams for every half teaspoon, whereas the children's liquid is 100 milligrams per teaspoon. The infant's is actually twice as concentrated as the children's, and the reason they did that is so that you can use a very small volume of infant's ibuprofen and still get the same amount of medicine. I want everyone to just forget that infants exists. I want you to only use children's, because if you do that, you're going to see that the dosage is going to be just about exactly the same as Tylenol. But we'll talk about how that works in a minute. The chewables, they do make 100 milligram chewables, which I think they taste pretty good. And some of the older kids like using those, so you might want to get some of those. As far as dosing ibuprofen, the dosing on the box is once again a little bit low, and I'm going to tell you the maximum dose that you can take. The dosing for ibuprofen is 100 milligrams, which, as we said, is 5 milliliters or 1 teaspoon. This again is for children's ibuprofen. We're not even going to discuss infants. I want you to use children's ibuprofen. It's 100 milligrams, which is 5 milliliters or 1 teaspoon for every 24 pounds. Just like Tylenol, we're going to dose it for 24 pounds. Now, as you can see here, we have the chart with the same weights on it. And here I've put a line through 12 pounds, because if the child's weight weighs 12 pounds, they're going to be less than 6 months of age. That's a very small child. So we're just going to forget about that. So don't use this less than 6 months. For a 24 pounder, remember it's 100 milligrams per 24 pounds. So for 24 pounds, 100 milligrams, that's 5 mLs. It's 1 teaspoon. For a 36 pounder, it's 150 milligrams. That's 7.5 mLs, and it's 1.5 teaspoons. And for a 48 pounder, 200 milligrams, 10 mLs, and it's 2 teaspoons. So again, these are actually the same volumes, 5, 7.5, and 10 mLs, as it was with children's Tylenol or infant's Tylenol. So if you use a children's ibuprofen, it's actually the same volume, and it makes it a lot easier to dose it. Ibuprofen can be given as often as every 6 hours. But if you use it very often, it might cause some stomach upset. Let's talk about alternating medicines to keep the fever down. A lot of people ask us about alternating medications, alternating the acetaminophen and the ibuprofen. And we will recommend that sometimes if we want to have tight control of a fever. For example, someone who has febrile seizures. If they have a high fever, they might have a seizure, or they have a history of having seizures. In those cases, we might recommend alternating acetaminophen and ibuprofen. And we usually do that every 3 hours. So you would take Tylenol, acetaminophen at like noon, and then you take ibuprofen at 3, and then you take Tylenol or acetaminophen at 6, and then you take ibuprofen at 9, and you go back and forth. That way you're getting something to control the fever every 3 hours, but you're only taking each medicine every 6 hours. And so that might be a little bit easier on your stomach. Now let me leave you with just some final tips. Ibuprofen seems to work better for most things, but it can be rougher on your stomach. The kids take that, and now you've got a stomach ache. Well, you're probably taking too much ibuprofen. So if you can get away with just using acetaminophen, or obviously if the child's very young, you don't want to use the ibuprofen anyway, then try to stick with the acetaminophen. If you give a big enough dose, it should work well, and you shouldn't have to reach for the ibuprofen. So that's an important thing. Try not to use these medications over and over and over and over. If you're using them for more than a few days, one, the child's probably going to need to be seen anyway, because that fever is just not going away. We're going to want to take a look at that child. We don't want to keep medicating over and over. And also, if you're doing it for more than a few days and you're doing Tylenol every single time, you may want to switch over to ibuprofen so that we're just not using the same medication over and over. Also, if you use these for a very long time, it's not good for your stomach, it's not good for your kidneys, it's not good for your liver. So if you're seeing that you're having to use these for more than a few days, you really need to get checked out in the office. Well, that should be all you need to know to dose acetaminophen and ibuprofen properly. Again, acetaminophen, 160 milligrams for every 24 pounds. Ibuprofen, 100 milligrams for every 24 pounds. And you can figure it out from there. Thanks for watching. Next time, I think we're going to start talking about ear problems, because swimmer's ear, we're going to have a lot of swimmers coming up soon. Otitis media, earwax, all that fun stuff. We're going to get into that. But thanks for watching. I'm Dr. B, and this has been The Buzz from Parenting and Pediatrics. See you next time.